Hi, everybody. Welcome to another session for Think Big, Act Now. Today, I'm joined by Richard, and we have a fantastic guest, Jon Wilks, to come and share some knowledge. And I'm super excited for this one. Richard, what are your views?
I think Jon brings a different dimension to what we've had so far, taking us from just, well, that's what I expect he's going to deliver to us, but making us think more widely and more broadly about the stage on which we put our teams and our staff to enable them to go out and really perform to the best of their ability, so that the audience, our patients, can really benefit from the skills, knowledge and hopes of so many people out there. So should we say hello to Jon?
Let's do it.
Jon, good afternoon. How are you? Great to see you. You're looking wonderful, if I may say.
Good afternoon, Richard. Good afternoon, Douglas. I'm grand, thank you. Never better, etc., etc. All the better for appearing on your show, if I may call it.
You can, and we will indulge ourselves and enjoy that. So good to see you. Jon, for those small number in the world who don't know you, you couldn't tell us the sort of things you get up to and what you do, and you know.
With pleasure. Yeah. I'm Chief Executive of the Institute of Health and Social Care Management. I'm a director of the Academy of Fabulous Stuff, which is a best practice repository for health and social care. I'm the town crier for the town where I live. I'm an appalling but very enthusiastic surfer, a hopeless but endlessly optimistic fisherman, and what else? I suppose, gardening. I'm having a go, but it's anything but easy going. Can I put it that way?
And in addition to that, I would add that apart from Douglas, you are the most sartorially appropriate person we've had on the whole show, and it's a joy.
Oh my God!
And the two of you are head to head this afternoon.
No, I'm behind. Look.
It's not a competition. It really is not a competition. I take my hat off to Douglas, a man of sartorial splendor, and Richard, you've got some serious thinking to do.
Right, now then, we've got to get into this discussion. Think big, act now. And what are we wrestling with? What are the challenges we face? How do we overcome them? So, Jon, let's get started.
As a clinician, we always told our current practice should match best practice. Yep. So we got NICE guidelines, CQC, all these bodies that tell us what best practice is. But also we know that we've had a lot of innovation over the last year or so due to COVID. We've accelerated digital ways of working without really measuring some of the best practice principles. So my question would be to you, how can clinicians find assurances in best practice when technology is moving so fast?
Oh, that's a good question. Let's put it this way. I think it's all about outcomes. I think if we concentrate on what people are achieving from their activities, best practice or otherwise, and we use the power of positive deviance to figure out whether that's worth investing in or not, then we're on the right path. So what I mean by that is, don't go about trying to find fault all the time with what you do and then put in place rectification plans. You know, that is the way of the CQC and others. And I reject it as a notion utterly. I don't think inspection has anything to teach us. You know, you typically turn up too late to do anything. You know, by then the harm has already been done. So positive deviance, trusting in the fact that other people might well have established a way of doing something better than you in advance of you, I think is a perfectly worthwhile mindset to get into. And it avoids this idea of, let's let every NHS trust, every faculty, every department, every ICS, every PCN, every primary care provider, every mental health trust, all trying to invent their own perfect wheel. You know, funnily enough, there are other people in this world who've got there before you, have been there, seen it, done it, are getting great outcomes that they are perfectly prepared to share with you. And you figure out for yourself whether that's something that you want to follow and invest in or not. I don't think we need to endlessly be looking for the finest scintilla of evidence to support it. Talk to people, share opinions, share ideas, have a go. You know, you've got to practice, you know, clinically safely, obviously, but have a go, share experience, discuss, collaborate, learn, and don't be so arrogant as to assume that only you can come up with all the best ideas.
Wow. Yeah, well, that's excellent advice. Go ahead, Richard.
I have a good friend who's an emeritus professor of leadership at Exeter, and he often starts a sentence with, "I'm intrigued by," what you were saying there is about the inquiring mind, isn't it?
Yeah,
the whole point about best practice is an inquiring mind. And I'm intrigued by, and off he goes, and you just go, what a great way to live your life, to be intrigued by things. I think it's a lot to be said.
And it's a great word, isn't it? Intrigue, because it conjures this idea that you are modest enough to give consideration to others. That's the bit, and I think this modesty is important. You know, you can be confident about what you say, but be modest enough to listen to other people's opinions and ideas. And then, you know, we're all of free will. Choose if you want to try to advance your own skills and abilities by adopting them or not. You know, I mean, as Douglas says, you know, the thing I liked about Douglas's question was, you know, coming from a clinical perspective where, you know, science is very evidence-based out of necessity. But I just love the fact that we are still prepared to listen to others and adapt what we're doing to seek continuous improvement. That's delightful. I cannot bear, you know, individuals and groups and organizations that are set in their ways and believe that they are at the pinnacle. Therein lies ruin, I think. You know, we can always learn.
How are you seeking to engage these different views so that you can share it on the platform, so people can say, look, it has been done before, it's done over there, let's replicate that over here?
Well, if COVID has given us anything, it's an acceleration of communication. So the very fact that I can sit at my desk here before you now, and you are one of 8 meetings that I've been able to have today without getting in my car or on a train, I mean, it's exhausting, but it's also enabling. Yeah. So what we've done at the Institute, for example, and to some extent within the Academy, is we've worked really hard to make sure that pretty much every day there's something going on through our special interest groups in particular, whereby people can come along, listen, contribute, discuss, and it's all about, let's find out what's going on that works. Let's find out other people's experiences. Let's listen to people who've demonstrably tried something and it's had a really good outcome. And I think that's the bit that has been really enabling during the pandemic. It's that this ability to listen and absorb new ideas, best practice, has become entirely possible if you're prepared to open your mind and accept the odd invitation here and there.
And where do you see that has really worked well? Are there places that have been more willing to do that? Or
yeah, I could look at something. If I look at big things that workforce well-being became a colossal issue, and I have to say continues to be. We still haven't got it right. It's still not taken seriously enough universally. But, you know, we realised through our membership there was a crisis of workforce well-being after perhaps 4 or 5 months of the pandemic. Yeah. And we decided we would create a special interest group of our members. We gathered as just an informal meeting, maybe 60, 70 people, something like that, the very first meeting. And everybody had got their own little example of something they'd done that had had a really good outcome. And so we created immediately, I think it took us about 3 weeks, just pulled together all of that, issued it as a guide about workforce well-being, practical measures that had gone on, broken up into sections, headers, whatever it was, and then had a conference 3 weeks after that, where we had nearly 300 people, I think, attended, all from our membership, all keen to find out real practical things that they could do, tomorrow, to make a small difference to people's everyday working well-being. And I love that. In 6 weeks, we went from nothing to here's a guide with, there must be 70, 80 pieces of guidance, advice, links, call it what you will, that people can home in on. From supporting women going through menopause, through to helping people who are reaching the end of their shift and they're dehydrated and hungry, to helping people just to get a bit of fresh air in company, socially distanced with walking groups and such like, that to me, that just brought alive the whole business of helping people to practically make a difference.
So that's so powerful, because it is the how-to. It's the #1 search term on the internet, how to do something. Sometimes within the health environment, people are too busy, and there's that picture with a caveman with pushing up a hill, a square object that should be a wheel, but it says I'm too busy, because someone's offering him a wheel and says it's too busy pushing this square object up this hill. So sometimes health are just too busy working, no time for recuperation to see there is a better way. So having this vehicle, this platform that you have there with real practical guides, steps, small steps that you can do to tweak.
And that's the crunch, Douglas. It's always the small stuff that makes the big difference. Yeah. And we overlook it, when you have national priorities, frameworks, pathways, perfectly laudable and sensible, but they are no substitute for on the ground, forensically looking at what we do and how we do it and the way we interact with our patients and service receivers, and figuring out small stuff that actually, if you do that well, that makes a big difference to people's experiences.
But so often that doesn't happen. It gets blocked and stopped, John, doesn't it?
Which is why it's the positive deviance that is the big enabler.
Yeah.
Stop frightening people about inspection and consequence of a poor inspection, because people will just go into a shell. They'll do the very limit of what they're supposed to be doing. They'll do it to their best ability, but they will not look for improvement and excellence because they're too frightened of the consequence of something going wrong. So you break that mindset of intrigue, as you described earlier on.
That's an excellent word, because when we spoke to Jenny Chong a couple of weeks back, she was talking about creating an environment where innovation you're able to manage the risk around innovation. So people feel comfortable with trying out new approaches, because again, being terrified of CQC means a clinician will typically go into reserve mode. Defensive practice is not liberating practice. It's just doing the bare minimum.
The unions used to call it work to rule.
Yes.
Yes. And that's what you get. And I'm not getting at the CQC specifically. We got members of the Institute who are hardworking staff members of the CQC. It's not the CQC, it's the mindset around we improve quality through inspection that is wrong, in my opinion, because I've seen too many examples where when you do it the other way, when you show people what great looks like and empower and enable them to go off and do it, that is a far more powerful and sustainable means of driving quality improvement.
Yeah, you're releasing people, aren't you, to perform?
Yeah, I mean, look, this isn't about compromising safety. This is just about enabling people to feel confident about exploring new ways of doing old things.
Yeah.
Yes.
And that is a perfectly sensible and laudable occupation.
Yeah. Can I just look, we've talked a lot in this series about health, but the Institute covers as well social care, which has, you could argue, the same issues, but some unique issues. What are the challenges you're seeing there, and how are they overcoming it on their side, as it were?
So I'm more interested in saying, well, how do we help the sector to deliver more, to attract better, and to deliver a service that the citizens of Britain are proud of? And I just look at workforce and the way that social care is structured, and I look at social care's ability to recruit and retain high caliber people with a vocational calling towards looking after others. And it doesn't take a genius to work out why there are huge vacancies across the sector, why we have huge churn in the sector, why people coming out of our colleges and universities kind of don't regard social care as a serious career option. And that's the first place I would start in answer to your question, Richard. First thing to fix, I think, is workforce. The NHS in 2019 produced an NHS people plan, and it's super. It's a good report. It's been kicked into the long grass because of COVID and wait lists and all that kind of stuff, but no people plan for social care. Non-existent. Because there isn't the will for the sector to get together and work with government and say, well, that's what we want to try to achieve. Let's empower and enable social care to come up with its own solutions as well. They are fearful. If you are an individual working in social care on a 0 hours contract, minimum wage, you are charging around from service receiver to service receiver in your little Nissan Micra, donning PPE every 20 minutes and then discarding whatever you've got. And you're knackered at the end of the day, and you spot an opportunity to improve. Really difficult to feel empowered to actually just do it.
Yeah, good point.
Do the right thing. Just really difficult because you are being measured and minutely managed and potentially inspected to make sure that actually you are operating in very strict parameters of activity. So I think that's a big part of this. Break this straitjacket that says when you come into social care to deliver care, you have to do it in this very tightly prescribed way. PS, we're going to pay you peanuts, and PS, we're going to inspect the living heck out of you.
Yeah.
And then you wonder why, people leave and they go and do something else. They go and stack shelves in Aldi or something like that.
Yeah. But is there a challenge there for the people watching this around the leadership role and leaders within all of our organisations to really grasp the nettle here?
Well, I've had the pleasure of meeting some really high quality social care providers. And they just approach things differently. They have an enlightened approach to leadership. They practice positive deviance. They invest hugely in staff training and staff welfare. They make sure their staff are paid living wage wherever possible. They make commitments, in other words, to their staff to help their staff turn what they do into a genuine career. And where that happens, it's sensational. You just look at the results that they get. You look at the delight that their service receivers and their families have in what they produce, and you just think, well, it's a no-brainer. The big difference, it costs money to do it that way, but they're looking long-term at the benefits of building an approach that they are certain they can look in themselves in the mirror and know that their service receivers, get a terrific outcome from them. So we can talk about leadership, and leadership can be inspired in social care, but that's flipping difficult if you are constantly under the cosh of a very strict regime around how you deliver the care. I find that, you know, I mean, the average care home manager, if we talk care homes for a moment,
Yeah.
you know, trust me, you know, these are people who at the end of every month are not looking at residual spend that they can go and blow on a super duper night out. You know, they are not well paid, and that's at management level.
Yeah.
And they are still required to be the registered manager, which means that if anything goes wrong, them personally that gets hauled across the coals. You know, these are hugely responsible positions. And you look at it during the COVID pandemic, and all of the raft of guidance, guidelines that were constantly being thrown at these people. And I have the utmost admiration for them. If they can come out of it and at the end of this still say, and look at these 5 new things that we did because we were prepared to watch other providers and learn from them, and actually our staff were brilliant and improved stuff, I just, you know, hats off. Because to me, we made life as a social care manager almost intolerable over the last 18 months. Can you imagine looking a family in the eye who are standing outside your residential home, for example, furious with you personally because you are just following the guidance that you've been mandated by government and not allowing them to go and see a loved one in the last few months, years of their life? Can you imagine what that would be like for a young individual who's just having to shoulder that whilst trying to keep the people within safe, whilst trying to keep his or her staff motivated, inspired, and healthy, whilst trying to make sure that stress doesn't overcome all of them, whilst trying to make sure the press down the road, you know, the local paper, are not going to be running some appalling story about them personally and about the fact that they are standing and preventing these families from coming in. And we wonder why we've got vacancies.
Yeah. COVID has definitely shone a light at some of the fantastic work that's been done across the whole care panacea. So I think, now, what's your view in terms of the re-educational piece for people in those positions that actually taking on more risk, taking on more responsibility, and are not getting the right rewards for it?
Number one, let's change totally the way that we set about training people in social care. P.S. I'm no great fan, actually, of Health Education England's approach to training people in the health sector as well. I think that, in many respects, is open to question. It's, you know, we listen a lot to our membership in the Institute who talk about their experiences of training that they receive. And too often it's far from inspiring and uplifting and enthusiasm building. Again, it's just a bit formulaic, a bit stale. It's very insular and kind of narrow. You know, funnily enough, we're an island nation. We can learn from the best overseas. But the opportunity to learn from the best overseas is very rarely adopted or looked at. You know, we just concentrate on what we do. We're very narrow-minded, I think, in our general approach to training. And I just wish we'd use the power of the National Health Service and our social care sector and change the rules and just find people who've got the competence and mindset to deliver world-class training to come and help us do it. Because I grow weary of the same old, same people, same faces, same approach, same results.
Yeah.
And it's just not great, in my opinion. I think it needs, you know, if I could wave my wand over it, I'd look at skills for care and health education and wave my wand over it and say, radical change required. Radical.
Absolutely. I agree with you totally there.
I'm conscious of time. So I'm going to need to draw us to.
It's been a wide-ranging discussion.
If I look back, I think you've touched on things such as well-being at the beginning that have shifted things markedly, the work you did around there. But if you look back over the COVID period and the successes you have seen and what people could walk away, what would be your headlines of the things people should walk away with and do, or hold close to their heart? What would your top three be, maybe, that these are the things I should just hold dear? And
let me have a go. So, number one, change doesn't take years to achieve. Change can be done in minutes if we decide collectively that it's important enough to do it. So that's the first thing. You know, when the pandemic came along, working practices, approaches, interfaces, collaborations changed in hours, days. Second thing, I think, is don't let anybody tell you you can't. There is always a way, if you're brave enough to search for it and listen to those who've got some advice or guidance to give you. Because what quickly became clear again in the pandemic was that where organizations were prepared to face outwards and listen and adopt best practice from elsewhere, they were able to respond to the pandemic far more quickly and effectively than those who just tried to keep reinventing their own wheels. So that's the second thing. And the third thing would be, we underestimate our patients at our peril. You know, our patients are ambitious, they're thoughtful, they're trusting, but they're sincere, and they've got some good ideas of their own. And the thing I like more than anything else, I think, is when some of the digital technology started to be used because we had to, because of the importance of isolation. The people who said our patients would never be able to do that and cope with it were just proved wrong. I'm not pretending it's perfect for everyone, but goodness me, it's perfect for 60 or 70% of the people who we're trying to reach. And that's a huge outcome improvement. So, and that's driven by patients being perfectly willing to adapt new ways of interacting with clinicians, social care workers, and call it what you will.
Because
I could make a request for something. It's, for heaven's sakes, please, can we take an adult approach to provision of Wi-Fi across health and social care? Because if we're going to use digital technologies, let's enable everybody in the country to have access to a rock-solid Wi-Fi connection.
Yeah, absolutely. Because that 60 or 70% of patients adopting digital freed up space to handle those that couldn't.
I remember for years we've been told it couldn't be done.
You
know, don't let's let people who put obstacles in the way of that over the previous 5 to 10 years, don't let's let them just off the hook and forget about it. You know, because they will be the same people now who will be standing up making representations for why certain digital technologies should now be discarded or limited or whatever.
Yes, absolutely.
It's entirely based on self-interest, in my opinion.
Yes, we have to keep the momentum going that we've got harnessed through the pandemic and drive through real transformational.
Well, look, my colleague Roy Lilly, Richard's already alluded to him. His big thing is, if you really want to drive quality improvement across health and social care, start from the patient or service receiver and work backwards. And you'll find the fault lines.
Absolutely.
Time and time again.
Absolutely.
But I think an overarching message from you is that it is possible. Whatever you think you can achieve is possible, but look up, look out and learn. Because
it was Henry Ford who said, whether you think you can or think you can't, you're probably right.
That's it then. At that point, I'm closing. I'll leave the quotes to you, Jon, and from Douglas and I and all the audience on Think Big, Act Now. thank you for your wise words. Thank you for your insight. It's been great. It really has. So thank you.
My pleasure.
The conversation was very fluid. It was organic. We did cover many different exciting topics and challenges for the NHS, including the social care challenges. Jon was able to bring home and articulate solutions to some of these challenges, which I really found fascinating, and particularly this whole positive deviance approach.
Yeah.
You know, as a kid, I was told that being deviant was a bad thing. So the fact is, there's a spin on it, which I found very fascinating.
Yeah, I think it makes me, I've always felt myself as fairly dysfunctional, so I feel better about the whole thing now. Well, but wasn't it good though to have somebody shining a light on social care and just helping us to see it from that perspective? Because I don't think thus far we've really picked that off. Although what he covered in social care, a lot of that equally, it comes across to health as well.
Absolutely. And we do know the green paper for social care has been delayed now 3-4 years. So it just seems as the more we kick it long grass, the more social care comes back. COVID has taught us that we've all become health consumers, expert health consumers. We've seen it through directly or with our loved ones going into care, social care systems, and all of that comes. And so we know what we expect from these services, and the public are right to feel aggrieved because they're not getting the service that they require. And we're also fearful what will happen when we become infirmed, unable to care for ourselves. So I think just the fact that Jon was able to go there, shine that light, the more light that's shone on this target, on this problem, the more people in power it's incumbent on them to find solutions now. And that's what part of the Think Big Act Now is about, is what can you do now? Yeah. And within our remit of expertise, we're helping bring people to this platform to shine the light so that other people can play the part as well.
Yeah. And didn't he shine a light equally on the importance of leadership? You know, that enabler, but you could argue Jenny did the same thing, and it just keeps coming up and up and up, that the power that effective leadership has, when it's used to release people to go out and perform to the best of their ability.
Yes, and I've seen it since being qualified since 2003. Leadership training has definitely changed within the NHS. I could talk about the NHS from being something that's autocratic, you know, dictatorial, to now we're, like Jenny, Jon, they're embracing different, should I say, philosophies in leadership, you know, inspirational leadership, things that are not really quantifiable as such. You know, there's not like results driven. It's like, just do the right thing and outcomes will be better in the long run. Yeah. So I think there's something to be said about encouraging people that are positively deviant, people that are quirky, people that are brave enough to put themselves out there above the parapet and say, look, if we work in this way, we can add real value, opposed to being conforming to how things were in the past, because we know there's not enough money for the NHS to sustain itself doing things the same way moving forward. It does require a different approach.
Yeah. And that approach is about giving people the belief that, as I think Jon said, you can do it. There is a way, you can make stuff happen. And how do we release people to do that continually every day in our lives? Because people can achieve more than they think and we think, and we've just got to enable them to do that. Yes, and that's a challenge, I think, for all of us listening in today.
So my take home for myself is to stop, you know, keep moving without reflecting on what I'm doing. Doesn't yield good results. Recuperate, rest, look at things with fresh eyes. I know, depending on what job you have, he did paint pictures of people working social care, how pressurized their time is. So no real time to stop and think, reflect, and change course. So how the system enables people to find that protected space to stop is very, very important. And so maybe there's an element for coaching, mentoring, because people like John, people like Jenny, these are fantastic, and Sally even, these are fantastic people that have so much to give back to not only to the people that work within their own, say, practice, outside of that as well. So I'm positive.
If through Think Big, Act Now, we've done our little bit to share those stories and those people's personas and hunger, desire, passion, energy, momentum, I don't know, hopefully we've helped, and hopefully we've helped all of you listening in, watching in this afternoon. Thank you for joining us. All the very best. Keep going.
Thank you. Take care.